Hi guys, this is Dr. Ayushi Bansal this side. So I'm back with another video today, and first of all, I hope everybody is doing good and all of you are safe totally at your home, your respective places, and are following the lockdown and quarantine if given honestly. So guys, please stay safe. It is very important nowadays. So today I will be talking about infectious diseases, like what they are. Like we are hearing every single day that COVID-19, Ebola, tetanus, etc. diseases are coming up, and these are all infectious diseases. So I will be talking about what an infectious disease is and how does it differs from a contagious disease. Contagious disease like COVID-19 is a highly contagious disease and it's an infectious disease also. So I will be telling you about what are infectious diseases and what is a contagious disease. And also I will be telling you about the transmission of these diseases, its preventive methods, and the treatment options available. So coming over to the infectious diseases, what are they? Infectious diseases are diseases which are caused by any pathogenic organism, like you can say bacteria, virus, fungus, protozoas, prions, like any microorganisms. So these have their own genetic material. They are multicellular microorganisms which have their own genetic material in form of DNA or RNA. Specifically there are prions, which are only proteins that cause a disease. They do not have any genetic material of their own, but they are harmful, you can say harmful proteins which can cause a disease in animals or human beings. For example, mad cow disease, it is a disease caused by prions. So infectious diseases are diseases which are caused by microorganisms. For example, you have common flu, COVID-19, Ebola. These are all infectious diseases. Even tetanus is an infectious disease as it is caused by a bacteria called Clostridium tetani. Now, coming over to contagious disease. Any disease which can be transferred from one person to another is called as contagious disease. So, technically all the contagious diseases are infectious, but all infectious diseases are not contagious. For example, common flu, it is a contagious disease and infectious as it is caused by a virus, rhinovirus, and it can be transferred from one person to another very easily. And tetanus, it is not a contagious disease, it is just an infectious disease. As I previously said, it is caused by a bacteria, Clostridium tetani, and it does not get transferred from one person to another. So hence it is just an infectious disease. Please mind it, all contagious diseases are infectious, but all infectious diseases are not contagious. So now coming over to the transmission method of these diseases, or so-called contagious diseases or infectious diseases, we mainly read about three main transmission processes. I will name them. They are contact transmission, droplet transmission, and airborne transmission. So contact transmission, in this transmission, like a disease is transferred from one person to another when you come in contact with the infected person's bodily fluid or blood or anything used by them. For example, any skin infection, chickenpox, or you get that MRSA. These are all contact transmitted diseases. So now droplet transmission, like you are hearing nowadays that please sneeze in your elbow, please carry your hanky for sneezing, do not sneeze directly in the air. So when a infected person sneezes in the air or coughs or vomits, so there are some specific aerosols which are generated, which can transfer, which get suspended in the air and can get transferred to the person standing near them. So by that, the other person takes those aerosols, inhale those aerosols, and they get transmitted themselves. For example, common flu, common cold. These are droplet transmitted diseases, and That's why it is said that don't come close to the, when you catch common cold, people say ki I got it from you because you were infected, you were already sneezing and I got it from you. So that is the reason common cold is something very easily spreads, because it is spread through droplets, and obviously you cannot see them through a naked eye, so there's a high chance of transmission from them. Now, coming over to the third transmission process, that is airborne transmission. See, that is when there are minute droplets, potentially droplets get exposed in the air, which we are obviously not able to see, and they stay suspended for around a lot of time, and they get traveled through, they are traveled through air, so you can just inhale them, touch them and whatsoever. So that is what an airborne transmission disease is, transmitted disease do. So that is a very easy source for getting infected again. For example, tuberculosis, Ebola, these are transferred through airborne transmission. And Covid-19, like we'll talk about Covid-19 also. This is a disease caused by coronavirus, as we all know, highly contagious, infectious, have normal symptoms, just like a common flu has, and it hurts. It mainly affects all people who are of old age, young age people, like just a child, elderly people, and people who already have some diseases like diabetes, hypertension, all the heart related diseases and etc. So they are more vulnerable to this coronavirus. So that virus gets spread through contact transmission. Okay, WHO has recently said that it is not an airborne disease, but it is a contact transmission which gets transferred by, from one person to another when you come in contact with any bodily fluid of that person. Even that could be a sneeze, air droplets. So it is a contact transmitted disease, and you have to be very careful with that, like we all know. Now, I just read in the news today that the toll for COVID-19 in India has just crossed 31,000. So we really need to we need to take precautions on every basis, and we have to stay safe for our family, for our friends. Now, coming over to the preventive methods which we use generally for all the infectious diseases are, like you've seen the doctors wearing masks, gowns, head caps. These are called as personal protective equipments, which generally are on higher rise nowadays, because every doctor needs it, every dentist needs it, every nurse needs it, every single person who is working in hospital needs it to stay protected from the COVID-19. So these are first line protective devices which we use to stay protected from highly infectious diseases. These are known as PPE, or personal protective equipments, surgical mask, gowns, etc. Now, second thing that is that we need to keep our hands clean. So we have to wash them again and again, as frequent as possible, and we have to keep everything around us sanitized, right? So, and also now from airborne transmission disease, the protective method is to use special masks which are called as N95 mask. These masks do not allow droplets pass through them, like either from the patient or from the doctor himself. These masks do not allow droplets to pass through them, so neither the air can pass through it. So that is what is important about N95 mask, which we are reading nowadays, that people are using N95 mask, doctors are using N95 mask, and everybody's asking for N95 mask. That's the reason why everybody's asking for N95 mask. So these are the preventive methods which we generally take to stay protected. And most important, social distancing is the best thing you can do. Try to stay away from all the infected people. Like even in a home, when a person gets cold, we try to stay a little bit away from them so that we don't catch it. So on a larger scale, to stay protected from COVID-19, this deadly virus disease, which is nowadays has become a pandemic across the whole globe. So we need to stay protected from it, and please follow social distancing, guys. It is very, very important. And those who have been quarantined, kindly follow this. It's just a matter of 14 days. You can stay at home and try to keep yourself safe and the community safe from this virus. It will be a very, just for the sake of humanity, do it, guys. Don't roam around the city by saying that we don't have any COVID-19, we don't have any symptoms, and we are totally fine, we can go around it. So please take care about it. Now, coming over to the treatment methods. As it is, in general, I will be talking about the treatment methods. So as it is these are microbial diseases. So antimicrobial drugs are there to treat them. Like for, antibiotics. Everybody knows penicillin, azithromycin and all. So these are all antibiotic drugs, and these are used for the infectious diseases caused by bacteria. Mind it, virus diseases are not treated with antibiotics. So antibiotics are used to treat bacterial diseases. On the other hand, antifungal drugs are used to treat fungal related infections. Antiviral drugs are used to treat virus related infections. Like your viral fever, viral disease is treated with antiviral drugs. No antibiotic will help it. Mind it, guys, please remember this. So, and the last thing, and which is very important for the treatment purpose or preventive measure, is a vaccine. You must be knowing that everybody gets a vaccine. If since childhood we are getting vaccines for some disease or the other. So what is a vaccine? Vaccine is like it is an inactivated or dead form of a microorganism which causes a particular disease, and it is injected into the person's body in small amount so that the cells, white blood cells, can generate the immunity for those foreign bodies, and when there is an actual infection, they can fight through it. That is what a vaccine do. So also the first vaccine ever was developed by Edward Jenner for smallpox, and hence we were able to eradicate smallpox. So that's all for the video today, guys. I will be coming back with another video soon. Please take care of yourself, stay healthy, stay safe, stay fit, and stay at home. Okay, bye.